Tulipoanza miaka mitano sasa kushirikiana na CDC.
The main work of the diocese is, of course, evangelization. And alongside that, there are many other things that we do because we do not only give our people only the word of God, but we also, following the style of Christ himself, we also seek to support our people in many other ways. Since I came, around the time that I came, that is when we started, we entered this project of Ungana with LVCT. The diocese is a complex institution. We have other activities. The area of health, of course, is one of the most important areas, but we have other areas like education, where we like to support our institutions. We have many institutions that we are sponsoring, primary schools and secondary schools, and even technical schools and schools of special education. So that is another area that the diocese is very, very active in, and which I would say in one way or other also benefits from those who support us. So then we also have other areas of activity like Caritas. Caritas is one of our organs that carries out activities that are development-like. So social development, socio-economic development, it's undertaken by the diocese through the arm of the Caritas.
Yes, my name is Gedaiga Tairas. I'm the Caritas Director for Catholic Diocese of Miurang'a. Caritas is the development and the relief arm of the church. And Caritas starts all the way from the highest level of the church, that is Universal, that is Caritas Internationalis. Then we have Caritas Africa, Caritas Amesea, Caritas Kenya, and then Caritas Miurang'a. As you know, the church operates in different spheres, and the church is doing both pastoral work and doing social development work. For the church is not just interested in preaching the gospel. The church is also interested in the social welfare of its people. So there are issues to do with education, there are issues to do with health, there are issues to do with economic well-being, empowerment, gender, governance and justice. All those are issues that the church is interested in. So as the Caritas Director, I'm interested in having the people develop economically, and of course at the same time to cushion the people when it comes to emergencies. Emergencies are fewer in Miurang'a and of different nature in other places. In some other places you would find that there could be floods, there could be severe drought. But here in Miurang'a, because of the terrain, sometimes if there's an outbreak of a disease, if there's a landslide, they are common here in Miurang'a, especially when it rains very heavily. So the church will be able to respond. Caritas also plays a coordinating role, and especially when it comes to developing proposals for fundraising for all the departments, including health and education. In terms of health, works in liaison with the medical department. The medical department, which is part of the social arm of the church, all of them under the umbrella really of Caritas, so that we would develop programs together and prepare documents for fundraising. And even when it comes to implementation, the Department of Caritas is very much involved in monitoring and evaluation of the programs that are being done in the diocese.
One, we have health facilities. By that I mean hospitals. We have 3 hospitals. We have four health centers and 16 dispensaries that are currently running, offering curative and preventive services to the community. We also have community education programs based in those health facilities. They do mobile outreaches to reach out to communities who are far away from the hospitals, less privileged, and also use those forums to educate the community on health issues that affect the people in their jurisdiction. We also have 4 comprehensive care clinics for care and treatment of people with HIV. And currently we have over 4,000 active clients in those 4 CCCs. We have 3 in hospitals, the 3 hospitals, and we have 1 in a dispensary. We also have the prevention of mother-to-child transmission services offered in 5 sites that has, I think, in 6 health facilities. We also have diagnostic centers and 2 based in 2 hospitals, where by the end of this month we should be having a CT scan, the first one I think in the diocese and in both counties, because it has been a gap. We've been referring for these services to Aga Khan and to Nyeri, and we will be having the first one. So that is also a program that is going to kick off very soon as part of our diagnostic programs. We have 3 centers in the 3 hospitals, but these will be the most advanced. We also have training of nursing students. We have a nursing college. So those are just a few of the programs we have under the health department. Our main partners one is the Ministry of Health. We have LVCT has been our very supportive partner. We have Afia Plus supporting care and treatment, and we also have Chuck CDC supporting care and treatment in one of the hospitals. So just to mention a few, then we have the Protestant churches, because we look at it, okay, all the faith-based, but we are the Catholic, then we have the others. They are also our partners. One, we have HIV testing and counseling, and we've been supported by the Ungana project through LVCT in offering provider-initiated testing and counseling, PATC, and that is the entry point to HIV care and treatment.
Ndio nijijue, nilikuwa nimepeleka mtoto kang'olewe meno huko Kaisanjiro, na tukiwa kwa Rhine kuna mtu mmoja alikuwa anakuja hapo anatuongeleza mambo ya HIV, anatuambia hata hao wanapima na ni vizuri mtu ajijue. Kwa jamii nilijikataa, ndio akasonga kama mtu mwingine hapo akakuja. Nilikuwa mmoja ambaye nilikuwa nimefika mapema, lakini huyo akakumbali akaingia. Lakini wakati mtoto aling'olewa meno, nilikuwa nimefikiria mambo mawili matatu. Kama huyu ameingia na amejikubali, mimi ni nani? Ndio sasa hapo nikaamua, nikaita yule sister nikamwambia, sasa nimeona, wacha niingie. Lakini first of all alifanya counseling kidogo, ndio nielewe ukijikuta negative vile utakuwa, ukijikuta positive vile utakuwa. Ndio niamua nikaingia, nikapimwa. Bahati mbaya au nzuri nikapatikana niko positive. Lakini ndio hapo niliamua hata huyu mtoto nilikuwa nimeleta ang'olewe meno, because he's the last born. Wacha hata yeye nijue hali yake saa hii kabla hatujafika nyumbani kwa mama. Hapo ndiye alipatikana yeye hana, lakini mimi niko.
My name is Robert Kuria, the County AIDS STI Coordinator, Miurang'a County. My docket, I work for the HIV program, or I'm the coordinator for HIV program. And we have a HIV prevalence of 5.2% in the county. And if you look at the epidemic, we have more women infected than men. And again, the HIV prevalence, we have more people again with HIV coming from the lower part of Miurang'a.
Then we have care and treatment. I told you we have 4 CCCs. And in these facilities that have comprehensive care centers, we have psychosocial support groups for the people who are accessing care and treatment in their facilities. We have over 25 support groups active. And in these support groups, we use the people who are in those support groups for prevention with positives. They are the best people to engage the community because they come from that community.
When we are having such activities, we do not only focus on our Catholic Christians. These are activities that are done for everybody, whoever is willing to come and join us to benefit from those services and activities that we have.
Tulipoanza miaka 5 sasa kushirikiana na CDC kutekeleza wajibu wa kusaidia kuangamiza HIV kwa nia moja. LVCT ikatuleta pamoja, tukaungana, brought us together under the umbrella. We stand together and fight against this disease.